I just want to make sure
Give me 1 second.
I had a little PowerPoint.
Rita, let me pull your bio up and then you can share your screen for your PowerPoint. Does that work?
Hmm.
Anybody got a good dad joke? Because my computer's being slow.
I think maybe we need a minute motivator.
This idea is one I can get behind. You know, let's go. Jose, I have you next on the list. Are you comfortable if I go to Sandy for this one? So we can push to a GC member?
Yes, yes.
Cool. Okay. So this is going to go to Sandy Ray, and the talk is titled "It Is the Climb." And I don't know if all of you know Miley Cyrus, but that's a song. So here we go. Real quick, Sandy, floor is yours for Minute Motivator. Again, 60 seconds, and then we'll go to our Power Talk.
Yes, I'll try to make this quick. My Minute Motivator comes from personal experience. So it comes from this time where I went hiking with my boyfriend, and I was told we were doing a casual 5-mile hike. 20 miles later, my feet hurt. It's a day hike. I'm climbing up, and he's an outdoor photographer. And so he takes a bunch of pictures. And at one point, he makes a comment saying, Sandy, look at these pictures. Have you noticed that I started zooming out on your face? Because you are starting to have a RBF. Because I was so annoyed with the fact that it was a 20-mile hike. I mean, I love hiking. I just need mental preparation.
Like a minute motivator.
So the conclusion of this is I look at these pictures and I see that, over time, I'm expecting a longer and longer hike. I'm expecting more and more hard work, and I'm putting myself down. I'm getting all these negative thoughts. And then we get to the top, and then you see these, and this is when I've looked back at these pictures afterwards, and you see the view and you see my face light up. You see that I was so confident that I did it. And I think this is what we need in like the mindset we need when we think of boards prep. Right now, we're thinking of this huge 20-mile hike that we have to do to get us to boards and to pass boards. But once we get there, we're going to be fine. We're going to do it. We're going to go to clinicals, and that's what we've been waiting for. And that's why we're here. We want to be doctors. So let's just think about that. Think about how, yes, it might be a little hard, but at the end of the day, when we look back, we're going to be like, we did it. We got there, and the view is great. It's the climb, guys.
Well done. Well done. That's our Minute Motivator. Taylor, back to you.
Sandy, that was so great. I just needed to record that. That was great. This will be cropped out. I'm sorry. Carry on.
All right, PR team, all yours.
Okay, I'm going to introduce Rita, my very own VP from ATSU Soma. Rita is a third-year medical student and our VP, like I said. This is her first time attending COSPG, so I'm very excited for her. She lives in Flagstaff and is currently completing an elective rotation in dermatology. She is considering pursuing a career in family medicine or internal medicine and has interests in women's health, palliative medicine, and comprehensive gender-affirming care. Outside of medicine, she loves the arts and attending musical theater shows, trail running with friends, and signing up for 10K races, which again, I don't do cardio, so extra snaps for that, and spending time with loved ones. She's really excited to be here. Go ahead, Rita.
Thank you, guys. I hope my connection is okay. So I'm just going to, okay, thanks.
Crystal clear, Rita, you're good.
Perfect. So I have never done one of these. So I was just like, oh, sure, I'll sign up. But I'm a third year at ATSU Soma, and I live in Flagstaff. And this is a case that I saw during my family medicine rotation, working with a DO, Dr. Tracy Crumrin, and she does a lot of OMT, so I learned a lot from her. And so the case is about a 54-year-old female who came to us to establish care. She told us just in passing that she has had chronic daily diarrhea for the past 20 years. And so we said, wait, hold on. Tell us more about that. She had an extensive workup with GI, who gave her the diagnosis of IBSD. She said that she's had diarrhea ever since this episode of food poisoning that occurred 20 years ago, and she has bloating and cramping intermittently. But she doesn't have any warning signs of blood in her stool, foul smelling, or abdominal pain, nausea, vomiting, or any recent worsening. And so we offered OMT as a possible therapy that might help her. She came back 2 weeks later and we did some OMT. We saw dysfunction of the OA, which we treated with MFR, myofascial release, and some cranial dysfunction, which Dr. Kerman taught me how to treat with BLT. We noticed some hypertonicity in the paraspinal muscle area and treated that with traction and MFR. And then notably, we noticed restriction in the celiac ganglion and the superior mesenteric ganglions. And so we treated that with direct inhibition and MFR. And then also noticed right upper quadrant abdominal fascia restrictions and treated that with indirect MFR. And we, when she first walked out of that appointment, she said she felt good and that it went well, but she didn't really notice any different, like most patients do right in that appointment. But 1 month later, she sat down and I went to go and talk with her first. And she took out a notebook of which she had documented all the changes that she noticed over the past month. And she said she was feeling better overall. And she noticed a positive change in her symptoms since her last appointment. Before she received OMT, she was frequently waking up at 3 a.m. to have a bowel movement. And now she had been able to sleep through the night and had a bowel movement at 5 a.m. And she noticed that her bowel movements had more substance and she wasn't having as many watery stools. And so she reported feeling like after she had a bowel movement, she wasn't having to go immediately again later. And she asked to keep having OMT in future appointments. And so I bring this up to encourage you all to at least just try offering OMT to patients. And I'm not honestly, I'm not like someone who says OMT should be used for everyone, everything, but occasionally it can be effective for people. And your technique does not have to be groundbreaking. You don't have to be the next Andrew Taylor Still. You just have to be willing to try and offer to people your skills. And you only get better with more practice. And this is an example of when OMT can be helpful for visceral complaints as well as somatic complaints. And I've personally noticed that the harder I try, sometimes the less effective I am. And so I called it inverse intention. I've just noticed that like if I offer it to someone, like it might help, it might not, but we could just try. Then ironically, it tends to be more helpful. So I just wanted to share this as a case presentation of when I found OMT successful during my family medicine rotation. Thank you.